Well, I'd like to thank the Brain Tumor Foundation of Canada for inviting me to present about my research project that was funded last year. And we're going to be talking about the relationship between white matter hyperintensities and cognition after whole brain radiotherapy. So by way of background, I wanted to talk a little bit about the treatment of brain metastases. There's many options. Patients can have surgery and radiation treatment. Some systemic therapies work for some brain tumors, and patients can also opt to have observation. Whole brain radiotherapy is the traditional method, and it's still commonly used because it's effective and very easy to deliver. The drawback of whole brain radiotherapy is that it can cause memory and cognitive impairment in some patients. Now, white matter hyperintensities are abnormalities seen on T2 MRI sequences. They're found around the ventricles and also in the deep white matter. The Physicus score was developed to provide a sort of rating of the severity of white matter hyperintensities in different parts of the brain. Now, what we know is that whole brain radiotherapy in some patients will cause extensive white matter hyperintensities, which has a particular name as leukoencephalopathy, and that's usually associated with a decline in memory and cognition. And this is the illustration of the Physicus scale from their paper. What we see on the top row is that patients with normal looking brain have a score of 0, and patients with confluent white matter changes around the ventricles have a score of 3. In the lower row, we're looking at white matter lesions in the deep white matter tracts of the brain, not necessarily around the ventricles. Now, it is thought that these two types of abnormalities may have different explanations, but they're both associated with cognitive decline. So in Vancouver, we did a study using a phase 2 trial that was conducted a few years ago to look at the association between white matter hyperintensities and cognitive impairment. Trial had 60 patients, and 46 were alive 3 months after radiotherapy. We had a team of radiologists do Physicus scoring on the brain imaging that was obtained before treatment. And the patients were divided into 2 groups, those with a little or no white matter hyperintensities with a Physicus score of 0 to 2, and patients with significant amounts of white matter hyperintensities with scores of 3 to 6. We performed statistical analyses to investigate how the white matter hyperintensity is related to cognition. In our study, the cognition was measured with something called the Montreal Cognitive Assessment. It's a cognitive test that investigates 8 different domains of cognition, outlined here in the black boxes. And it was designed originally to detect and track early dementia. It's been used in many trials in oncology, and particularly for patients with brain metastases. So on the next slide, I'm going to present the sort of raw results from the study. Patients who had no decline in their cognitive scores are the dots, and the patients who did have cognitive decline are the crosses. So the younger patients here with lower age, and the patients with lower Physicus scores, indicating less white matter hyperintensity, they as a group tended to have no cognitive decline as indicated by the dots. All the patients over 70 had cognitive decline after whole brain radiotherapy, and many more patients with elevated Physicus scores and older age had cognitive decline. We also noticed that some patients had really severe cognitive toxicities from whole brain radiation treatment. And this is something that hasn't been reported before because in other trials, these patients don't contribute to the data. So there was one patient who's 72 who did have cognitive testing, showing a substantial decline. And they were extremely sleepy for several months and ended up requiring nursing care for the rest of their lives. They did have leukoencephalopathy in follow-up. An older patient who was 83 was too confused to come for their cognitive testing at 3 months, and they ended up spending the rest of their life in a nursing home. Another patient who was 71, again, was too sleepy to come for their cognitive testing at 3 months and spent the rest of their life in a hospice. So we were quite concerned about this because it's not something we'd seen observed before, and we wanted to investigate it further. These are the statistical results. When we did univariate analyses looking at age, Physicus score, number of metastases, and the volume of edema, we saw that age and Physicus score were predictive of cognitive impairment. When we looked at the age and Physicus score together in an analysis, we saw that the age remained significant, but that the Physicus score lost its significance. But the odds ratio is still high, suggesting that if we did the study again with more patients, we might confirm this finding. So we put together a project and submitted the project to the Brain Tumor Foundation of Canada. The co-investigators are the same team that did the initial study at BC Cancer. We have the radiologist, radiation oncologist, we have a neuropsychologist, neurologist, and a statistician. The plan is to obtain the data from 2 trials that are managed by the Alliance for Clinical Trials in Oncology. The N0574 study was for patients with 1 to 3 brain metastases, and they were randomized to either get radiosurgery alone or radiosurgery plus whole brain radiation treatment. In the N107C trial, patients are randomized. All the patients had brain surgery to remove a brain metastasis, and then they were randomized between radiosurgery to the surgical bed versus whole brain radiotherapy in the control arm. So by assembling these 2 trials, it'll give us a cohort with 198 patients treated with whole brain radiotherapy who we expect to get post-treatment leukoencephalopathy, and 209 patients treated with radiosurgery alone who are unlikely to develop this complication. Our hypothesis is that patients with more white matter hyperintensities on the baseline imaging as measured by Physicus scoring will have more cognitive decline after whole brain radiotherapy than after radiosurgery alone. In the Alliance trials, there were 2 cognitive tests used. The Hopkins Verbal Learning Test is largely a study used to investigate memory, and then the 2 trail making tests that were used are tests of spatial reasoning, and those were obtained at baseline and then every 3 months follow-up. The patients also had MRIs at baseline and every 3 months. And we'll be looking at the baseline imaging to see what can predict for subsequent outcomes. The planned analysis is to define a decline in cognition or a cognitive event in statistical terminology by scoring it when we see a decline in both memory and visual spatial reasoning. We use logistic regression to analyze the association between these cognitive declines and baseline variables, including age, Physicus score, prior craniotomy, and the number of brain metastases treated with radiosurgery. And we'll develop predictive models of cognitive decline, and these models will be investigated to see which ones provide the most accurate predictions, presuming, of course, that our results are favorable. There will be some challenges with this. There's likely to be quite a bit of missing data. in the clinical trial database. We're going to require the expertise of the statistician and the neuropsychologist to manage this missing data and determine how to do the analyses. And the progress on the study to date, the Imaging and Radiation Oncology Core Branch of the American Board of Radiology has de-archived all of the MRIs from CDs and put them on their digital image sharing platform. And the Alliance for Clinical Trials in Oncology is in the process of cleaning the patient baseline and outcome data from the 2 trials and preparing it for upload to the National Clinical Trial Network Data Archive. And once that's completed, we'll be able to download it for the study. So at the moment, we are waiting for our data. So in terms of the clinical significance of this project, if we're able to use the Physicus score on patients' baseline brain imaging from the time of their diagnosis of brain metastases, it's a very quick score to perform, and will allow clinicians to make an assessment of which patients are most likely to experience severe whole brain radiotherapy toxicity. And then, of course, other management strategies can be used for those patients, either surgery, systemic therapy, or observation, or stereotactic radiosurgery. So I'd like to thank the Brain Tumor Foundation of Canada once again for allowing me to present. And thanks very much for your attention.